Welcome to Adapting Class. If you're studying for the NCLEX or in a nursing school and looking to boost your confidence, you are in the right place. As you know, I have a Q bank associated with my on-demand and a crash course. And sometimes I'll go over the questions that students have answered. And I've realized there's some areas that they have problem with. So today we're going to review some of the most commonly missed NCLEX questions, practice questions that students often struggle with. These questions cover some critical topics that can make or break you during your regular exams or in the nursing school. The first question, of course, you have to be prioritization. You have to master prioritization in the NCLEX. You have to feel comfortable. I don't know what kind of method you use, but I deal with what we call be sharp. You have to be sharp. Is it a breathing issue? Is it an electrolyte issue? Is it a sepsis issue? Is it a shock issue? Is it airway issue, right? Is it lethargy regarding neurology? And then pain. If it's pain, is this pain is you're going to lose your life or limb or eyesight? These are areas you have to focus on and say, hey, if I see this, I should be worried about. So what is the way to answer questions? Start from the back. Which client should be seen first? First, that means prioritization. A nurse is aware of what? For client as change of shift. That means the nurse has option. 1 second. She has to be sharp. He or she has to be sharp to pick which patient need immediate intervention, who has a problem, who does not have time. Then go through each of them and see what is the problem, and then figure out what you need to do. I always say divide the question into two. The first portion is just introduction, but the last portion of the question is what you should focus on. A client with what? Black tarry stool, bleeding, right? He has hemoglobin of what? 10, 11. Think about it. A client with what? Asthma. Is he airway issue? Who has what? Severe tremor after what? Abodral. A client with what? DVT on Coumadin, whose PT is 55. A client with what? Acute myelogenous leukemia, who has what? WBC of 4.5 thousand. You have to be sharp. Do you see any breathing issue? Asthma, you say it's a breathing issue. But what? We give the patient Abodral and the patient has tremor. Unexpected finding. You got to be sharp. Do you see electrolyte issue? I don't see that. Do you see a shock sepsis? Yeah, maybe. What? A patient who is bleeding with hemoglobin of 11 is not dying, right? Black tarry stool is bleeding with hemoglobin of 11. Do you see any hypothermia, hypoglycemia? No. Do you see an airway issue? Asthma patient is not having airway. It's just tremor after what? Abodral, right? There's no neurological issue. There's no pain issue. But if you look at three is also a bleeding issue. It can go into a shock. Somebody with a DVT who is on Coumadin, PT of 55. Your normal PT is between 11 to 12. A 55 of PT, that means more than 4 times of your PT. Too high. This patient is going to bleed to death. He may have hemorrhage. So you have to be able to put your content together and be able to figure out what is going on. Don't pick the answer choice just like that, but think about it. You have to be sharp. You have 1 second. At the same time, bring your content. I say you can't do prioritization with that content. Otherwise, you just be guessing. This patient who has DVT on Coumadin with the PT of 55, that's too high. So that's our patient that we should see. Number one is done. And this is how you do it, prioritization wise. Okay, if you need more, Adapting NCLEX has a lot of prioritization. I always call it the home of prioritization. Which client assignment is the most appropriate for the LPN? Assignment is big in the NCLEX. Management of care. You have to be comfortable. Like I told you, these are commonly missed. But why? Because there's something there. A nursing team consists of what? RN, LPN, and UAP. When they give you every member of the team, the next thing you tell yourself, everybody should stay in their lane. An RN will stay in their lane. LPN stay in their lane. UAP stay in their lane. Everybody should stay in their lane. That means whatever UAP can do, that is all they're going to do. Even though some of the things UAP does, LPN can do, right now, there is three of us. We stay in our lane. What does the UAP do? I always say, what? Nothing that requires thinking. If you say go check vitals, it does not require thinking. If you say go measure urine output, does not require thinking. In addition to what? ADL. How about LPN? I call it MMR most. With the M, most medication, monitor everything, reinforce the RN. They can do stomach care, right? All those things that are associated with the RN can do. There is an adjective you can use, which we call MMR most. That means they can monitor, they can reinforce, they can give most medication, they can do ostomy, some special tests, and they can do tube feed. RN, basically, education, assessment, teaching, and the first of everything. This is what I've done. Before I even look at the answer, I brought my content and I look at each answer choice and I said, what? Range of motion exercise every 4 hours. That's something I should give you a UAP, even though the LPN can do that. A G-tube need bolus feeding every 4 hours. The LPN should be able to do that. Needing assistant out of bed, I should give it to a UAP. Requiring discharge teaching, that's RN. So what should the LPN be assigned? Which tasks should the LPN be assigned? It should be what? Number 2, which is what? Because they can do tube feeding, they'll be able to take care of the G-tube. And this is the right answer. Analyzing the question critically, and it will pop out like a candy. Same thing. Which assignment is most appropriate for the nurse, right? What is the issue? Pediatric nurse. She's floating to a medical surgical unit due to a nurse shortage. When they give you a floater nurse, the key concept is what? That nurse is a baby nurse. She does not know anything to wherever she's going. She's a nurse, but she's a pediatric nurse. For your board, consider them, treat them like a new nurse, a new graduate nurse who has no clue about surgical nursing. What you do next, give them patients who are specific for what? Their specialty. So if there's a kid there, you give it to them. Or if there's a condition that is common in pediatric patients, you give it to them. Don't give them any specialized patient. Don't let them discharge any patient. Don't let them provide teaching. Don't let them what? Assess any patient who just had surgery. Don't give them any specialized patient for the unit. Post-gastric bypass is a specialized patient. She's 24 hours, new patient. Post-gastric artery bypass graft, cabbage, is too sick for this pediatric nurse, even though she's 48 hours. And she has chest tube. Pediatric nurse may not be comfortable with that. Cholecystectomy, awaiting discharge. She has no clue about adult discharge teaching regarding cholecystectomy. Appendectomy, 48 hours, and eating, most stable patient who can be given to the pediatric nurse. She's eating, or she will need probably some pain medication. And so number 4 is appropriate. And nurse realized they administered the wrong medication dose to a client 2 minutes ago. What is the nurse best action? Best action, prioritization, 101. I have 1 second. If I have 1 second, what would I do? I can do all of this by 1 second. Notify the provider and monitor the client. Is that what you would do? Complete an incident report immediately. Is this what you should do if you have 1 second? Document the correct dose in the client's chart. What do you think? Notify the charge nurse. Think about it. You give a patient a wrong medication. It's going to cause a problem, wrong dose is going to cause a problem for the patient. Assess how the patient is responding with the medication. Of course, we need to do incident report. Of course, we got to what? Let the charge nurse also know later on. We don't need to write correct what dose. You are not being truthful. Therefore, what do? Let the provider know, but not just like that. Assess the patient. The monitor the client there means assessment. I know sometimes they use words in the question, but you have to step back, eliminate other answers. You can see number 4 is irrelevant. Number 3 is irrelevant. Number 2 is irrelevant. So even though it's a monitor, it means you are assessing the client. You're looking at them. You're already giving them the medication. So you're seeing what effect the medication would do because you give the wrong dose. So number 1 is your right answer. And this is caring for a client newly admitted with what? Left pneumothorax. Okay. A chest tube was placed immediately. They put a chest tube in. Which item is most important for the nurse to keep at bedside? You have to know your concept regarding chest tube. You have to know what you need. What are the ways you will care for the patient? If you need more, I have free videos on chest tube on adapting class, or you can subscribe down and you get more content like that. Or you can join our on demand or our membership where we have restricted video that you will never forget with over thousands of videos that may help you prepare for your NCLEX or if you're in nursing school. But there's certain things you need to have as a nurse if you're taking care of a patient with the chest tube. Of course, you need a sterile gloves in case the chest tube come out, right? You need 250 ml of bottle of sterile water if the chest tube come out, right? You need antiseptic wipes if the chest tube come out, right? You need a stethoscope, right? If the chest tube come out. But the most important is the 250 ml of sterile water because it's easy for the chest tube to come out from the pleural vac. And if you kick it and it come out from the pleural vac, you can put it in and wait. Of course, you may also need antiseptic wipes. You may need a stethoscope to listen. You may need a sterile glove. But one item I will pick as number 1 is the 250 bowl of sterile water at bedside in case the chest tube come out. So number 2 is your right answer. Which condition should the nurse expect this medication to treat? Select or apply. SATA means there's more than one answer choice. For these new generation NCLEX, look, when they give you SATA, I want you to sit down and tell yourself, I'm not picking anything unless I'm 101%, 110%, 120%. That means you have to be 100% sure that, hey, what I'm picking is right. There is no guessing game because there's 6 question answer choice there. If you guess, you get 0. They're very smart. Sometimes they'll give you 5 and only 1 is right. Nobody want to pick one answer choice from 6 options. But that is the purpose of select or apply nowadays, to trap you. Therefore, what do you think? A nurse is caring for a client prescribed what? Fluoxetine. Pharmacology. You have to know it. There's some few medications you have to know it. And one of them is this. I've done a series on pharmacology for nurses. If you want to watch it, it's on YouTube. Not all of them. I've done 12 videos. Half of them belong to the members. So if you join the membership, you can get access. It's on the playlist. You can watch all of them. But this one of the medications, SSRI. They love asking it. Whatever board exams you're taking, you have to recognize it. This SSRI. What is he used for? The easiest one is what? Depression. Everybody knows that. So you take that. Schizophrenia is psychotic problem. You don't use it. Anorexia, think about it. Anorexia people don't want to eat, and we want them to eat. One of the medication we give them is to treat the underlying depression and these will let them gain weight. Fluoxetine is very good for anorexia patient. They will gain weight. It can also be used for anxiety. And since it can also be used for anxiety, you should prick this. Post-traumatic stress disorder. It can also be used for it. It's not good for bipolar. It's not for mood stabilization. So depression, anorexia, generalized anxiety disorder, post-traumatic stress disorder. If you don't know it, check Adaptive Class. You get the content regarding this. But these are things you have to know. Most commonly missed questions. This is why they're a little bit difficult, but it requires critical thinking. I'm showing you how you should approach adapt NCLEX questions. Don't, or when you're doing questions, there's a way you can approach it. When you see it, just step back, figure out what you have. This is the same thing. Select or apply. One of the questions you should expect what it means. Sometimes risk factors, teaching, education. That is what it means, right? Intervention, right? These, which statement should the names include as an example of therapeutic response? This means content related to therapeutic response. Underline the buzzword. The buzzword is therapeutic response. And what does it say? Include, then read the case. And next is teaching a new graduate. It's a teaching question about what? Therapeutic communication. What is the content related to therapeutic communication? If you watch my mental health questions, I have a free video on therapeutic communication. You will learn everything about it. I don't give you all the definitions because it's unnecessary. There's few things you should know therapeutic communication. Always ask for more questions. Don't pass the bag. Basically, do the question, answer the question the person is asking you. And always, you don't talk. Let the patient talk. But if the patient wants you to talk, ask for more questions. That's all. This is all you need. And you can use it to answer every question. Don't talk. Ask for more questions. If the patient wants you to talk, go ahead and ask for more questions. If they ask you to do something, don't say, I'm going to ask anybody. Ask for more questions from them. We have great doctors here. You'll be fine. How do you know? Let's talk more about the issue. Basically, asking for more questions, right? Tell me more about the issue. Asking for more questions. Everybody say the same. Just do it. How do you know? That's a cliche. I know how you feel. How do you know how she feel? He or she feel. You are not the patient. The question say therapeutic response. Don't put yourself in the situation. You cannot help the patient. She know what she's talking about. So which one you should include? Let's talk more about the issue. Engaging the patient. Tell me more about the issue. Asking for more. So 2 and 3 is the most appropriate. You see, if you select more, you get 0. A nurse is assessing a 6-month-old at the pediatric clinic. It's a 6-month-old at the pediatric clinic. Order the following steps for a nurse performing the assessment. This is pediatric. You can't pass the NCLEX if you're very weak in peds. Peds and maternity is big. Find some place to learn all the peds stuff. I have a bunch of playlists, bunch of practice questions, content related, all the things you need to know. Some are for members, you can become a member, but there's a bunch of free growth and milestones, all of them. There's certain things you need to know about pediatric assessment. I have a playlist about pediatric assessment. Watch it. You master it. There's the steps. Which one? Do you check the patient highs, right? 6 months old. Or do moral reflex. Palpate the abdomen. Check, listen to their heart sounds or their respiratory pattern. There's the way. The key concept to answer. You don't memorize this. Please don't memorize. The key is less invasive test first. If you look at it, which one is less invasive? Do you actively doing something or you looking? If you can look is the best way. You're not touching the patient. The idea is if you make the baby cry, you can finish the test. Don't make the baby cry. Therefore, the best way to examine a baby who is 6 months old is to look first. And if you're touching, touch things that are easy to touch. The easy way, number 5, observe respiratory pattern. While mommy or daddy is holding them, you can see the baby is breathing. Is it breathing fast? Are they using the accessory muscle? Easy way. You can give them a stethoscope and then you can listen. So followed by 4. As you listen to their heart sound. You see, these are less invasive, right? And then you can touch their belly. Palpation of their abdomen is easy. Palpation of their abdomen is very, very easy, right? Easy to do it. Then what? Check their eyes. Then you can check the eyes. Before you do moral reflex, because you got to throw them up. And then it's very startle movement. So as you do Monroe, you got to be careful. If you do it first from the beginning, the baby is not going to be happy. So you start from 5, 4, 3, 2, 1. It's the best way to examine these patients. So observe, listen, and then palpate, then check the eyes, and then I do the Monroe. So 5, 4, 3, 1, 2. This is the way you should examine this patient. If the last thing you should do is the Monroe, and the first thing is to observe. Okay? So that's what this question is asking you. Which of the following client require referral to the interdisciplinary team? A nurse is caring for 4 clients on the medical surgical unit. Interdisciplinary team means somebody who has a bunch of problems that involve multi-systems, multiple system, multiple specialty, right? Somebody with acute appendicitis just need a surgeon, right? It doesn't need physical therapy, it doesn't need pulmonary people. If you have influenza, maybe a lung specialist, that's all, right? If you have cystic fibrosis, you have too many problems, right? Dietitian, physical therapist, social worker, a bunch of people that need pulmonary guys, GI guys to get you involved. So that patient needs interdisciplinary team. Migraine, you need just the neurology or your primary care doctor. So 3 is the right answer. And the last question. A client echocardiogram showed left ventricular ejection fraction of 20 and an S3. Which of the following findings should the nurse anticipate on assessment? That means, look at it, a left ventricular ejection fraction. So this is your heart. And your left ventricle, how much blood is putting out is just 20%. And you have S3 gallop. This is heart failure. You're not pumping anything. That means the left side is affected. So this is the same thing. Rewrite the question. It's a patient have left heart failure. That's all. What do you expect? What are the signs of left-sided heart failure? It's mostly pulmonary congestion and what? Outflow problem. Outflow means your blood pressure and urine output. I see urine output here. That means, and pulmonary congestion, you're looking for lung sounds, lung symptoms, right? Crackles of your lung is pulmonary problem. The rest, if it doesn't involve your lung, you don't pick in it. Central venous pressure of 8 is normal. A JVD is right-sided problem. Increased abdominal girth is right-sided problem. This is the same question. While you're looking at the question, looking at the answer choice, and looking at everything, say, I think they're asking me about left heart failure. They will do that in the board exams. They want to let you think critically. The question is not vague, but it requires you to second thinking. These are, when you answer these questions, you know that you're doing well. This is a left-sided heart failure question, and you can see that 1 and 2 are mostly associated with the left-sided heart failure. The 3, 4, 5, 4 and 5 is right-sided, and 3 is normal. So the answer choice is 1 and 2. Thank you for watching. I hope you learned something. If you like this video, You can put the click button over there and share the video and subscribe to Adapt NCLEX to grow the channel. If you want to join our membership, you get more content like that. If you're in nursing school and you want to pass your nursing exams, come to Adapt NCLEX. You have a bunch of videos that will help you. And if preparing for your boards, these are videos you want to watch. Take care of yourself and good luck. Never stop charging. Keep charging.